So I'm Tom Koutsoumpas, President and CEO of Capital Caring Health. We at Capital Caring Health are delighted to be a platinum sponsor of the AAHCM virtual annual meeting and to support the Academy, which is at the forefront of home care medicine. We so value our partnership with the Academy to advance home care medicine and break down the silos between primary care and hospice. This work is transformational for the senior population, which, as we know, is a rapidly growing demographic. Thanks to the Academy for its cutting-edge leadership and focus on caring for people in their homes. Well, home-based primary care is especially important and valuable at this time, clearly with the risk of COVID-19 and the risk of exposure to COVID-19 by going out and into the community, into offices, being able to keep seniors at home, being able to have the full range of services in the home that they could get if they had to get out to an appointment is really a tremendous opportunity and tremendously valuable. It eliminates the risk, it's safe, it eliminates issues around transportation, exposure to COVID-19, and really allows seniors to feel comfortable that they're safe at home and yet able to address their medical needs. You know, one of the things I worry about are the concerns of safety, of leaving home, getting out, and therefore maybe not getting health issues attended to. That's a real concern. Home-based primary care eliminates that. So it's a tremendously important service, especially now when safety is so critical. At Capital Caring Health, we are focused on creating the continuum for people to begin getting services at home through primary care at home. Our program is led by Dr. Eric DeYoung, our Chief of Geriatrics and former President of AAHCM. We have had a tremendous opportunity with Dr. DeYoung to create this continuum, begin caring for patients at home well before the end of life, well before their need for hospice care, but creating that continuum so that we can care for them throughout that entire part of their lives. We start with home-based primary care, but we can deliver services all the way to the very end of life with our hospice services. Creating that continuum is extremely important. It allows patients and their families to have services in their home with one provider that allows for continuity. It allows for a long-term relationship to develop, trust, and support. And our view is that's really a critical way to care for people, seniors especially, in their homes during this period of their lives. We've had a lot of accomplishments this year as we've focused on creating that continuum. We've forged new partnerships with retirement communities to provide high-quality care for their residents. We've worked with the American Heart Association and other not-for-profit organizations to develop comprehensive cardiac care programs for those people at the end stage of heart disease. We've been using telehealth and telecare to connect with patients during this particularly challenging period, which has also been tremendously important. We've also recognized the issues around equity. At Capital Caring Health, we've created the Center for Equity, Inclusion, and Diversity to focus on the huge disparities for people at the end of life and during this particular period in their lives, beginning with their need for primary care at home. We've also grown our hospice and palliative care and pediatric program, which is tremendously important. So all of these things are what we've been focusing on at Capital Caring Health, and certainly working with the Academy, who leads the way, who's in the forefront of primary care at home and home care medicine, has been a tremendously important part of our opportunity and focus to develop these extraordinary programs. Well, I think we're certainly going to continue to develop our programs as we've described and more. We're looking at other ways to continue this growth, to break down silos to create a continuum that's integrated, that's collaborative and coordinated, and that we can be a place where seniors can come, establish relationships with us, and that they'll be fully cared for throughout this entire process of their lives. Think about the peace that provides, the safety, the relationships, the trust. It's a wonderful opportunity for us to provide those kind of services in the home and have that very special relationship with those people that we care for.